Do the Covered California rates have anything to do with reality? Hi, I'm Kevin Knaus with InsureMeKevin.com. And every summer, Covered California has this congratulatory, celebratory announcement about the health insurance rates that they have negotiated for the next year. And in large measure, that has nothing to do with what people in Covered California actually pay. However, it is public relations, and we saw in the LA Times Covered California health insurance premiums to increase 1.8% in 2022. Just a meaningless headline, because that 1.8% is a weighted average. There's 10 different carriers. But Covered California achieved their goal of making it sound like they're doing a wonderful job in California at regulating the rates. And this is all meant for politicians, elected officials, regulators, and special interest groups. So when they read that announcement, they go, "Oh, 1.8%, very good, Covered California. Oh, you're doing a wonderful job." And really, they are doing a pretty good job. But I just don't like the illusion that somehow this is translating into the Covered California membership, because it really isn't, because of the subsidies. And your rates are really governed by a couple different things if you're with the same carrier. Your age, and this blanket universal increase or decrease. And that's what Covered California is talking about. But let's look at your age first. The rate sheet, and they are published, all carriers do this. They haven't been released yet, so we don't really know for 2022. But this is of 2021, a silver plan. You can see the rates go up every year from age 14. There is that one little band in there for the early 20s where it is flat. There is no rate increase. But we come down to age 30. You can see going from 30 to 31, yes, you are celebrated for getting a year older with a 2% rate increase. Happy birthday. It gets worse when you get older. There are costs to aging, as I know. So going from age 56 to 57, it's a 4% increase. Regardless of any blanket decrease or increase, it's just going to be a 4% increase on the rate for getting a year older. Now, the blanket increases that apply to most middle tier plans in a particular plan type, those are governed somewhat by factors of healthcare utilization, the costs that the carriers have negotiated with the health plan. And Covered California did put out a weighted average increase of the different carriers that participate in Covered California, and these plans can also be bought off exchange directly from the carrier. And we see that, Anthem Blue Cross, they're saying their rates went down 2.5%, LA Care 2.9%, Molina 0.1%, and Sharp Health Plan 0.7%. Everyone else had a little increase. And so the Covered California takes that and mushes up all the numbers. And there is actually a statistical formula for determining the weighted average of 1.8%. But obviously, you can see right there that it doesn't necessarily mean anything to the average Californian. Health insurance and the rates are personal to you and your family. Now, this weighted average doesn't take, we can't see that it's taking into consideration some of the different plan types. Anthem Blue Cross has an EPO and an HMO. Some plans have HMOs, PPOs, and other plans. And so we just don't know where the decreases or increases are. And that can be significant. Now, Covered California in the announcement gives a lot of information, real high-level statistical stuff. But again, it's not granular. It's not really very specific. It's high-level stuff to make them look good. So California has 19 different rating regions. 19. The health insurance rates in Northern California are about 30% higher than those regions in Southern California. And again, that has to do with the contracts that the health plans have with the different regional hospitals and doctor groups. Region 1, we can see it actually went down 5.8%. Region 1 has 2 carriers, Anthem Blue Cross and Blue Shield. Anthem Blue Cross only offers an EPO. Blue Shield offers a PPO product and an HMO product in some areas. But we don't know from this who went down. Was it Blue Cross? Was it Blue Shield? Was it just the HMO? They don't really tell us. So you don't really know if those rates are going to have any impact on you, that negative number. Down in Southern California, if you go down to region 15 and 16, that's Los Angeles County, that has about 448,000 people in covered California. And when they do the weighted average, it comes out to 2% for region 15 and 1.9% for region 16. Now, that 1.8 is a weighted average. The more people there are in a particular plan in a particular region have more impact at determining the final number. So Southern California, as you can see, has most of the population. So they're the ones that are influencing that 1.8%, weighted average. So if you live in Northern California, it's even less relevant. Now, one thing I could never really understand on these rate announcements is they have this column that is shop and switch. And I read that, and the first thing that comes to my mind is this reptile telling me that if I just switched, I could save so much percent on my car insurance. Health insurance is not car insurance. You do not change it every season like an overcoat. It's somewhat offensive. It's like California thinks consumers are dumb. They're telling them, you're not smart enough. If you just switch plans, you could save some money. Well, maybe they're already in the lowest metal tier plan they can afford. Or, hey, if I change this plan, I lose all my doctors and my hospitals. But from this column, it's kind of like, hey, it's just insurance. It's just a doctor. It's just a hospital. Switch and save. But it makes covered California look good to the regulators, elected officials, politicians, and special interest groups that covered California, they're looking out for the best interest. They're helping people switch and save money, like car insurance. It doesn't work that way. It doesn't work that way. There is one great table in the announcement that really kind of illustrates the impact of covered California and the subsidies. And they break out the different people by the federal poverty level, because that's how the subsidy calculations are done. And they give the total premium and how much they saved. And then, of course, we had the American Rescue Plan that happened in 2021, which increased the subsidies. But, bottom line, people above 400% of the federal poverty level, which oftentimes didn't receive any federal subsidy, they're 342 was the net premium, and that looks like it was 70% of that. That was a subsidized amount, and so it works. That number, those subsidies swamp any increase that any plan might have, and of course, the subsidy is relative to your income, your household size, what region you live in, what age you are, and a number of other factors, including the second lowest cost silver plan, which is a whole other discussion. So, a 1.8% weighted average for 2022 is absolutely meaningless. It makes covered California look good, but it does nothing for the individuals in covered California. You just need to continue to be an eagle eye looking at the rates and how it all changes for you when we have open enrollment. So don't get your hopes up that your rates are only going to increase a moderate amount. Matter of fact, those people who are receiving the unemployment benefit in 2021 where if you received unemployment for at least 1 week, you're getting a huge subsidy, and that goes away in 2022. Some people are just paying, $1 for a silver plan, family of four, $4 a month. Normally, without that unemployment benefit, they might be paying $200 a month. So in 2022, all things being equal, their health insurance may jump up from $4 to $200. And you can do the math, and that's a lot higher than 1.8%. And that's all that matters. What you pay every month is the only thing that matters, not statistical analysis of weighted averages. It's all a little bit complicated. If you have any questions, please reach out to me. I'm Kevin at insuremekevin.com. Have a wonderful day.